love you like that. Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.
In with this week's edition of Health Matters, I am your host, Shevanee Nisbett, Health Educator at the Health Promotion Unit. Our eyes are very important, we need them to see. So Nevis has an eye care program, which is an ongoing program for over 20 years. And with us this week, we have Dr. Raymonde Hubbe, and he will be doing the first week of the eye care program, which is a 4-week program. I am here today to speak to Dr. Hubbe about the program and some of the benefits and some of the equipment that we have for the ongoing program. Here is an interview with myself and Dr. Hubbe. I'm here at the eye clinic with Dr. Raymonde Hubbe and his team, and I'll have them introduce themselves as to what they do in the eye care program. Dr. Hubbe first.
Hello, I'm Dr. Hubbe. I'm the medical director of the Nevis eye care program, and I've been coming here for 9 years. This program was started by Dr. Bresnik almost 20 years ago.
Hi, I'm Ginger Byrne. I'm Dr. Hubbe's wife, and I've been involved helping with administration and coordination in the clinic.
I'm Lenore Pemberton, and I'm the patient schedule coordinator.
Hi, my name is Nurse Jaffers, and I'm responsible for doing visual acuity, tension, and visual field at the eye clinic.
My name is Donna Hill, and I am a community health nurse. I also assist with doing the same duties as Nurse Jeffers does.
Okay, Dr. Hubbe, tell us a little about the eye care program, like its history and objectives.
The eye care program has been here on Nevis for 20 years, started by George Bresnik. And he was careful to make it a cooperative program with the Ministry of Health here on the island. And we have benefited very greatly by working with the nurses here on the island, some of the public health nurses, and the program is working with these nurses to reach out to as many patients as we can on the island to take care of conditions such as glaucoma, cataracts, and diabetes.
Okay. And who is it basically geared to? Like, what are your target age groups, and are there any specific target diseases?
Well, it turns out that our patient range is pretty much everything. We see kids all the way to people 100 years old. But most of our patients are elderly because eye problems tend to be more common in the elderly. Nevis has a lot of patients with glaucoma, a lot of people with glaucoma, and that's a big problem that we treat. And most folks with glaucoma are usually 50 and older. Other problems we treat are diabetic eye disease, and that can be at any age if somebody's diabetes isn't well enough controlled. It happens more often when people have poorly controlled diabetes. Finally, we treat a lot of cataracts, and we have a team from Milwaukee, and this team from Milwaukee that does the cataract surgery has been coming for over 10 years.
That's good. And I know you have a follow-up patients. You have patients who come for follow-ups. What about new patients or younger patients? Are they welcome to come to the clinic? And like how long is the clinic going to be running for? And tell us the times you can come to the clinic if it's open to new patients.
Well, the clinic is running until the end of April this year. And the best way to get connected with the clinic is to call the Charlestown Health Center.
Okay.
And Nurse Daniel is the one that's in charge of scheduling new patients.
Okay.
So we don't just take walk-ins because we have a schedule and we want to have some sort of control over how busy it gets.
Right, right. And so are you welcome to new patients come in, or?
Yes, we are. Yes, we are. And it's, certainly if anybody has an urgent reason to see the eye doctor, we'll see the people right away. But generally it's best if you're a new patient to give Nurse Daniel a call.
Right. And tell us a little about the equipment or materials that the Alexandra Hospital has that caters to your eye clinic. And you could also tell us about any new equipment that you have gotten donated or brought with you.
Yes. Well, we have this eye clinic here, which has 2 rooms all set up for seeing people for eye problems.
Okay.
And this includes a chair in each room for the patient to sit on. It includes what we call a slit lamp, which is a special microscope to examine the patient's eyes, and numerous lenses for looking inside the eyes, as well as other ophthalmoscopes, which are ways of looking into the eyes that are separate instruments. In addition to that, there's an operating room in the hospital, and in that operating room we have a microscope, for a surgical microscope, and we also have stored here equipment for doing cataract surgery, and the kind of cataract surgery we do uses ultrasound and suction, and is the most up-to-date way of doing cataracts. And the surgical team from Milwaukee brings most of the extra equipment they need each time they come. But some of the equipment resides right here. Finally, we have numerous lasers. We have 4 different lasers for treating things like diabetes, diabetic eye disease, for treating something we call capsular opacity, which happens after cataract surgery. The membrane behind the implant lens becomes cloudy, and that laser treats that. And we just got a new laser that I brought down with me this time, and it's called an SLT laser, and it's specifically for treating glaucoma.
Thank you for bringing that with you. I'm sure it's useful.
By the way, that was donated by the Four Seasons Homeowners Foundation.
Wow. We'd like to thank the Four Seasons Homeowners Association for the new laser machine.
Yes, very much.
Okay. And based on your, you've been coming here for a while, so you can compare, I guess, your general results when you've been looking at the eye issues in Nevis. What is your general take on Nevisians and their eye care or their eye issues? What would you, in your opinion?
I think in general the Nevisians really take responsibility for their own medical care very seriously, and I find that most folks that have glaucoma, for instance, take their drops like they should be, so I think most people really do take care of themselves very well, which is obviously very important, because if they didn't, they would end up losing vision.
And do you have any difficulties, whether it be with patients or anything else, during the program, like while you carry out the program when you're here on your visits?
Well, there's also always challenging patients who
Right.
have difficult situations and problems that aren't among the usual problems, and sometimes those take a little extra special review or extra medicines, and sometimes follow up numerous times with the doctors that are here while we're here.
Okay. Okay. And what should individuals who want to, are there any specific signs for individuals to look at if you have eye issues, or if you're thinking I should go and see the doctor? Is there anything in specific they should pay attention to which would make them want to go and see the eye doctor?
Certainly, anybody who has diabetes should come and see us.
Okay.
And they should also go and speak to Nurse Daniel to get that arranged.
Right.
I'd say anybody who has a family history of glaucoma should have their eyes checked every so often. Anybody who's got vision that's getting blurry, it's not correctable by glasses, should talk to see if they can get their eyes checked. That could be cataracts or any other number of other things wrong with the eyes. And finally, if anybody has pain or light sensitivity or other problems with the eyes, we can also take a look.
What about headaches? Is headache?
Well, I would first see your primary care doctor
Okay.
about headaches.
Right.
But if the primary care doctor thinks that it might have something to do with the eyes, they can refer to us.
Okay, that makes sense. And how important is it for people who are already eye care patients as well as other individuals to get checkups as often or to come in and just check their eyes out?
Patients that are already coming to the eye care program should already have scheduled exams. And some of them, like patients that have glaucoma, we see every 6 months. Patients that have diabetes, we see every year. And then certainly people who've just had cataract surgery have numerous follow-up visits afterwards. Other folks, in general, it's good for anybody over the age of 60 to have an eye exam every 2 or 3 years, okay? Because they might be developing cataracts and things like that. Younger folks that are very, very healthy and don't have all these family history problems or diabetes, probably every 5 years would be adequate,
Okay.
as long as they don't notice anything else going on. But if they have a family history of glaucoma, they might want to be seen more frequently than that.
Okay. Okay, got it. And how often do you visit Nevis, and when will your next visit be?
Well, I've been coming twice a year for the last, this is my 8th year coming twice a year. And I plan to continue to do that for the next foreseeable future, okay?
And is there any specific times in the year, like early year, late year?
We come in April
Okay.
and sometimes into May, and also in November. It's usually sometimes that goes into December.
Okay, and tell us a little bit about the program this time around, like who's coming, the doctors that are coming, what are they going to be doing, how long the program is going to be running for this time?
Well, I'm here this week with my wife Ginger assisting,
Okay.
and I'm just here for a week. Next week, my partner in my practice back home, Dr. Bruce Blyman, and one of his colleagues from friends, also in ophthalmology, named Frank Massey, is coming down, and they've known each other for years, and they're going to be running the clinic next week. The week after, there's 2 doctors who are both retina specialists. Dr. Robert Feig, who's come, this will be his 3rd trip here, and Dr. Henry Choi, who's going to be his 2nd trip here. And they're going to be here for 1 week, and they're going to be doing a lot of treatments for diabetes because they're retina specialists, and that's what they do.
Okay.
And finally, the last week coming here is going to be Dr. Ted Ingus, and he's come numerous times, I think 5 times or something like that. And he'll be here, the only doctor here during the last week. And he's a general ophthalmologist and will be dealing with general problems.
Okay. So, okay, got it. Is there anything that you would like to advise the vision public, especially those who might be seeing eye problems, or even those who haven't, that any kind of preventative methods or anything you would like to advise?
Certainly, if you're somebody who spends a lot of time in the outdoors, especially if you do that for your work, wearing sunglasses is really important because otherwise you might get these growths on the surface of the eye called pterygiums. And so a lot too much sun can also cause cataracts too. So using sunglasses is really important for people who spend a lot of time outdoors. Secondly, folks that do more dangerous work outdoors, like weed whacking and hammering nails and general construction, wearing safety glasses would be really important.
That's some really good advice because there are many people who I know, and I'm sure you know, they work in the sun a lot or they're outside a lot and they don't wear sunglasses. And I know sometimes, especially if you have sensitive eyes or you're accustomed to being indoors all the time, when you go outside, it's kind of, it makes your eyes sensitive. So I'm sure sunglasses
is a really good idea.
Okay. And Dr. Hubbe, is there anything about the program that you might want to mention or put out there?
Well, I'd like to thank many people for being so generous to help this program exist. First of all, we have a cooperative arrangement between the Ministry of Health and the Nevis Eye Care program, and that's really important for its functioning.
Right.
Secondly, there's the doctors that come are all volunteers, and that's why the clinic can be a free clinic. And a lot of people have donated to the program, some anonymous and some others, to make us be able to buy some of the equipment and to allow patients to be treated. And for instance, most recently this laser was donated by the Four Seasons Homeowners Association. We're so thankful for that, and that's the latest donation. But also we have some of the pharmaceutical companies donate the drops we use.
Okay.
And that's a pretty big donation. Both the two big companies that donate are Alcon and Allergan. And finally there's a small company called Wilson Optical, Wilson Ophthalmics, who donates some of the drops too. And without those we'd have a hard time functioning. Also on the island, some of the local hotels help out with lodging for the doctors.
This program is really good. I'm impressed by what you told me today because I learned a lot. Some of the things I didn't know about the eye care program, but it's really beneficial to the population. Could you tell me some of the feedback you would get, especially the positive feedback you get from some of your returning patients? I'm sure some of them are glad to see you when you come back, right?
Oh yes, many people thank us many times. Some people every time we come. Also, lots of people ask how Dr. Bresnick's doing because they remember him from the beginning of the program.
Okay.
And they're very thankful to about that.
And like you said, a lot of these patients, they take good care of their eyes, so they're listening to what you're saying and they're taking your advice, right?
Yeah, they do very well. They do very well.
Okay.
And I hope they continue to. Hello, this is Dr. Hubbe again. This is one of the examination rooms for the eye clinic. And we have the patient chair and what we call a slit lamp right here, and an ophthalmoscope right here. And in the back, this is our extra surgical microscope. That's the backup one, just in case the main one breaks. And over here, boxes contain lasers for treating diabetes, diabetic retinopathy. And this laser is a YAG laser for treating cloudiness that happens after cataract surgery, which is called capsular opacity. About 25% of people who have cataract surgery will eventually need to have that laser treatment. And this is the other eye exam room, and the main thing to see in this room is the new laser, which was just donated for treating glaucoma. It's called an SLT laser, and it's hooked up to this slit lamp for treating the patient. This is the laser part, the gray part, and this is the unit that drives the laser. and the control panel and the foot switch. And it was just brought here this week by myself. And this is the laser that was donated by the Four Seasons Homeowners Foundation. And we're very thankful for that.
And that has been this week's edition of Health Matters. I would like to thank Dr. Hubbe and his medical team for being here and promoting and giving us professional eye care attention for the week, as well as the other doctors that will be coming here for the extent of the month. I would also like to thank the Four Seasons Homeowners Foundation for donating the equipment, as well as the Ministry of Health and all the other doctors and nurses who have made this program possible. This has been this week's edition of Health Matters. I am your host, Shevanee Nisbett, health educator at the Health Promotion Unit. The fruit of the week is grapefruit. Grapefruit is full of vitamin C and can also help you lose weight if you want to lose weight. So have one grapefruit each day this week.
Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing